Everybody, and welcome to our first online clinical instructor orientation. So this is a new way of trying to do everything. When even thinking about getting all of y'all together with everybody's crazy schedules, you know, we all have families and we're all over the place, and we're all nurses, so you know, we usually have more than one job, right? It's impossible. So I really wanted to do a good thorough orientation for everybody and really give them a good understanding of how to use Blackboard, the differences between the new clinical learning packet, how to upload those to the journal, how to retrieve them from the journal, what the students can see, and hopefully that can verify and answer some of the questions and stuff that you may have. There's not a whole lot of changes, but we do have a couple of new clinical instructors this semester. I'm very excited about that. We have Phyllis and Tanya, so welcome to you guys. Phyllis is going to be at Iredell Hospital for this semester, and Tanya's going to be at Northern. So we're very excited about all the different clinical locations that we have. We increasingly get more and more, and it's great because our students come from everywhere, as you know. They travel. We have a student traveling from Boone, we have students traveling from Charlotte, we have them coming from Virginia. They're all over the place, so really utilizing all these different clinical locations helps not only the students, but it helps provide working community relationships as well. First, I just wanted to say thank you. The students love you guys. All of their feedback was received, and like always, they always have very positive things about their clinical learning experiences. I think that's by far their favorite part of the nursing program because they really get to do hands-on and be with patients, and that's why they're here, right? So they can be nurses. So I'm at home because it's for sci tech, so I'm emphasizing the tech part of that. My computer at home has a little bit more capabilities than the one that work has. So I thought that I would do that this year for our orientation. I am sharing my screen with you guys, and I'm going to kind of go through Blackboard first and foremost. All of you have observer access in Blackboard. I've already sent that in, and they've already put you in, so you could get in there right now. So you can see everything that I'm going through. Your screen, your Blackboard may look a slight bit different, but not too much. And the students' views look a little different as well, but not too much too. And I'll show you exactly what the students can see here in a little bit. So the first thing when you do when you open Blackboard for our course, it is set up as NUR 102, and it's the parent 2019 course. The first thing it opens up to is announcements, and you'll see that LPN life with the stethoscope and the heart and stuff like that on there. I'm pointing this out because it's the spring semester, and it never fails that we have snow issues and ice issues. It's North Carolina. So oftentimes the school doesn't announce what we're going to do as early as we need them to. You know, a lot of our clinicals start at 6:30 in the morning, and the school hadn't made that call yet. Our students are, traveling from Charlotte, and it takes them a long time. So we place that on Blackboard for all the students to know. That way you don't have 50 million students texting you saying, Miss Austin, what do I do? What do I do? And Miss Turner, do I supposed to come to you today? I don't know what to do. I can't guarantee they're still not going to do that, but hopefully they know to come here, and this can help decrease some of the confusion in regards to weather. And you're more than welcome to text me, of course, at any time with any kind of confusion or any kinds of questions in general. I think most of you have my cell phone number already, but just in case you don't, my number is 336-710-2073. Like I said, the best way to get in contact with me was actually to shoot me a text, because I'm like you guys, I'm all over the place. Oftentimes I can't answer my phone, and so the best way is to text, because I can usually shoot you back a text during a meeting rather than pick up the phone. So here is where you'll find your announcements right there in the front. The next tab on the left is the instructor contact information. This has all the information for all the full-time faculty. If you need to get in contact, with anybody, if you need to know Miss Galloway's number for 103 and stuff like that, that's in there, along with their office numbers and how to reach them, their email and stuff like that. Course information, I want to point this out as well. So if you go ahead and you click on that, it shows you, this is where it houses like the policy book and the module, stuff like that. So for your policy book, it's, that's important to know that that's there. It's there for you. It's there as well for the students. The policy book does have rules in there about clinical, about wearing your clinical uniform and the expectations of that. Like they need their student badge on, and their hair needs to be pulled back, and no visible tattoos, and all of those rules and stuff like that can be found in the policy book, as well as not showing up late for clinical. We all hate to turn away a student that is late. That's one of the worst things. Hey, you're late. I'm sorry. You're going to have to go home, and it's a clinical absence. At the very beginning of my clinicals, I explained to them, hey, I hate to send people home and I hate to do stuff, but guess what? That's my job. You're doing a job as a student, and I'm doing a job too. So I have to actually follow my job's rules, or I'm the one that gets in trouble, So I like to say that. I also like to tell the students it's better 3 hours early than 1 minute late. Just to be on the safe side. It's just a silly saying. I think Ben Franklin or somebody said that. But there's where the policy book is. It also talks about how many absences they're allowed to have. So clinical absences, they're allowed to have a maximum of 11.5 hours. So that's going to be one full clinical day for those that have clinical just 1 day a week. So like Sherry, that has a full day, and Phyllis has a full day, and Barbara, have full days. Pam does as well. But those are, they're allowed to miss one full clinical day. And of course, they can't miss any portion of that, because a clinical absence is either coming to clinical, if you're a tardy, that they have to be sent home. And that tardies are coming to clinical late, or if they have to leave early. If they have to leave clinical early, that's considered a clinical absence. They can't take half of an absence. So they would only be allowed that. That's 2 days for those that have clinical on 2 days a week. So let's say, Tanya, you have clinical on Tuesdays and Fridays. They're actually allowed to miss, 2 of the clinicals before they're dismissed from the program. Really, they are not allowed to miss anymore. Moving on. So that's where the policy book is. But moving on, the spring module, there's the module for the course for this, for spring 2019. All of y'all also receive a module, a paper module, so that y'all can refer to that. Since we're doing our orientation online this year, you all, starting next week, Monday, can come anytime and pick up your materials. And so there it'll have your sheets and your policy violation forms and your student referral forms and module and schedule and stuff like that, which y'all should have received your schedule via email already. But anytime next week, starting on Monday, come by the office, and I'm going to be placing those in your box. I think most of y'all have a box. If you do not have a box and you're new, I'll be putting them in my box with your name on it. They should all fit with ease in your box. I'm not going to do the big notebooks or anything because most of this is accessible online, as well as, y'all have most of the stuff and probably 18 million notebooks by now. So I was trying to decrease that a little bit. So there's your module, as long as you'll have another one. There's a calendar for students to access. And that's that little tab. That's about all that you would need to know under that course information. Next, moving on, unit outlines and PowerPoints. I just wanted to point this out, just because oftentimes, I know when I was an adjunct instructor with the ADN, I would go under Sherry and Miss Tate's Blackboard, and I would pull their stuff up, just to have something to do in post-conference. And I would say, oh, so they're learning perfusion this week, and I'm going to go over some of these main drugs in this PowerPoint. And I just kind of skimmed through it, and it just gave me some ideas on what to do for a post-conference. Hey, I know what you guys are studying too. I can keep up with your stuff as well. Let's do some activities around what you're learning in class. That way it's relevant, and they're starting to, that they're more involved because they want to learn, so they can be, good and up to date for their test and stuff coming up. Assignments, y'all won't need that. Then the next one that you will need, which is really the main one that y'all will be using, is clinical information. So if you click on the clinical information tab, it's got everything here that you would want to know for clinicals. So this is their journal is the first one, and that's where they're going to upload their journal every week. That's also where you will retrieve their clinical learning packet so you can grade them and look at them. This is a blank version of the clinical learning packet. So you can see what they can download that and save that. And we'll go through that step by step here in just a little bit. Guidelines for the CLP, the clinical schedules, and the clinical out rotation. So I'm going to kind of step through a lot of these things right here, but I'm going to start with your clinical schedules. So if you click inside the clinical schedules, it's got all of your schedules here. So there's Michelle's and Sherry's and Karen's and Phyllis. So it's got everybody's clinical schedule there. And I'm just going to pull up for an example Miss Casey's schedule, because there is a deficiency on there, a boo-boo that I made that I wanted to point out, and then kind of go over how to read it as well. So we're just going to kind of look at this first student, which is Haley Paris here. So on the first week, on clinical week 1, she is going to go to clinical, which she's at Iredale, on both 115 and 116. That's going to be more of her orientation days, right? That first week, get to know the hospital, get to know the facility, what's the computer system like, doing computer training, glucose monitor training, that kind of thing. Then the next week is those skills rotation week that, that I've talked to many of you about. And thank you so much for your participation in that. The students really enjoy those days. That's going to be on main campus. So therefore, the example with Haley, she will not be going to Iredale that week. She'll be going to main campus. So that's her clinical week that week, as well with everybody. Then the next week, clinical week 3, 129 and 130, she goes to clinical. And now we're jumping to February the 5th. So she is going to be off on February the 5th, but then she has labor and delivery with Miss Turner on the 6th. So the reason why I'm pointing these things out and really going through this clinical schedule is to let you guys know that everybody's schedule is different. So everybody's got the same hours, but because we're kind of have these out rotations, and because our hours vary from 1 day to 2 days to the days of the week to the amount of time that people are allowed to be at a clinical location, they vary. So say for example, Haley is off on 2/5 on February the 5th. Another student may have to go to clinical the day before their labor and delivery. And that's, like I said, to equal out those hours. So you may hear, students love to talk to each other, and you may hear, no, I don't think that, I think I do have to come to clinical on February the 5th. And then I go to labor and delivery because that's what such and such said. That's in, Miss Gilliam's group. Well, no, it's different. It's different for every student, so it's really important for them to follow their own schedule because it is going to be different. The example with Haley here, moving on, so April the 2nd, so that would be clinical week 11 right here. She goes to simulation, which is on Stakes campus, and then the next day on April the 3rd, she would be in clinical. And as you can see on her schedule, Melissa's schedule, students are kind of rotated out sporadically, and that's to help you guys decrease that number of students. We were real lucky this year to only have a maximum of six students per group, which really then rotating them out, even decreases the number a lot more, so each student gets a lot better clinical learning experience. Okay, the boo-boo I wanted to point out here was this down here. On everybody's schedule, I have that final evaluations are on May the 1st. That may be true for some of you, and it is not true for some of you. I just kind of copied and pasted the format, and that was one that I was did not change by mistake. But so, for example, in her schedule here for week 15, she has evaluations on 4:30, not on May the 1st. Evaluations this year, I did that differently as well. When I calculated the hours and stuff up there, I allowed for your day of evaluation to be not a full clinical day. That way, if you want to take your students to meet them and do evals at IHOP or Cracker Barrel, I've done both of those. Or if you want to meet the students at school and schedule individual evaluation times, you can do that. And if you want to do that, I do that as well. You can just please email me and let me know that's what you're planning to do, and I'll make sure to reserve a room for you so you have a spot for you and your students to go to. So that's all for y'all. But that way you're not accounted for a full day, and it puts that pressure off everybody, and you can really just enjoy your last day being with your students. Okay. So I hope that was helpful. I put that in as hours, so all of their hours are here. I just decreased those number of hours for that, so you could be allowed to do, kind of that. All right, so we're going to back out of that, back to the clinical schedules. There we are for everybody, and then going back to the clinical information. So that was under your clinical schedules. As you saw in the example with Miss Casey's schedule, she had Haley, right? And she was going out for her clinical rotations. So if you have a question about any of the clinical rotations, not knowing where to go, or I don't know if that student was really supposed to be on that day, you can click right in there and it'll have a master list of their out rotation. So this is the one for Downtown Hilton Plaza for their OB rotation with Tracy and Kristen. And you can see the master list of all of the students and when they're supposed to go. And they actually have people that come in the morning and the afternoon, so the student's going to have to be very aware and know which time that they come and be responsible for that. They're all adults. They should know how to do that. Let's hope. Okay. I actually did want to go back in there just for a minute. So here we are. That was the OB rotation and their requirements for the OB rotation. There's the simulation schedule, and there's the mother-baby for Barbara. This year our students get an incredible opportunity to be on labor and delivery and experience that at Iredell Hospital. Iredell is a newer facility for us. We've had them within the past couple of years, and they love us and they love our students. Now they've given us this opportunity for our students to experience this. Barbara, I did just want to point out, and I know this is irrelevant for the rest of you, but for Barbara in particular, I did upload all of that information, the Iredell that you had given me with the labor and delivery for Iredell, and I put that as a requirement for each student to read before they go to their labor and delivery experience. So that's all loaded here on Blackboard for them, so they can see, brush up on newborn assessment tools and cervix, sizings of cervix, positions of labor, all that kind of stuff is there in particular for those students. So back into the clinical information. So now we've seen what their clinical schedules are. Now we've looked in there for the clinical out rotations. You know what's in there. This is our open lab schedule that we have posted. I put this, the students see this, the students see everything that you're seeing now. there really isn't any need for you to know this, but when we, if you have to make a referral for open lab, a student referral, this is just the time slots that they can go. Because if you do make that referral, they would need to be an open lab before they are allowed to go back into your clinical. So they need to be aware of that. Those of you that'll be on main campus on January the 22nd and 23rd for the skills rotation days and the HESI days, I'll be emailing you guys. You already know which days and everything that y'all are going to be at, but I'll be emailing y'all exactly where y'all will be and all that kind of stuff. I think that's actually on those schedules right there anyways. But I'll have those schedules. I'll email you those schedules and let you know exactly what's going on, what time slots and everything. I kind of told you before that it would be 8 to like 2, and that's still the same with a break for lunch and stuff in there. Going back up, now that we've been through all of that, I do want you to see what the students can see as well. And this, like I said, they can see everything that we've been going over. But when you have that student that says, you know, Miss Hermione, I don't know how to upload my CLP to the journal. I've never done that before. Well, they all were required to do that during first semester. So let's hope that they did that. They all are required to upload to the journal. That is a requirement now that we do. That, you know, we're, as many of y'all know, we're seeking our accreditation from NLN for the, and so they'll be coming and doing a site visit with us, and they'll be really looking at this electronic paperwork. So that really needs to be in there. Our ADN side is not doing electronic paperwork yet, and this is a lot of universities are not doing that. So this is something that's really new and upcoming, and I do, so they're really going to be taking a peek at that. So it's very important that you utilize those tools and have your students submit to the journal. But if they come to you and say, I don't know how to do that, they have I don't know how to fill out my clinical learning packet, I didn't know what a concept map was, they have these instructions right here. So the clinical learning packet guidelines are written instructions per section that tells them exactly what to do, and that's written. Then we have a whole example, CLP example. So that will tell them exactly, you know, gives them an example exactly on how to fill that out. That's a great reference for you guys too if you're, you know, going, golly, well, what should they put there? You know, we put examples and stuff in there. Medication card guidelines, again, those are written instructions and stuff and guidelines for them to follow for their medication cards. Also an example. There's guidelines for safe administration, and using and submitting your electronic CLP step-by-step guide. And I want to open this up just so you can see what it looks like. And like I said, this is right at y'all's fingertips too, right on the blackboard that y'all can get to. But I do want to show you what they see. So if they say, I don't know how to do my CLP, it is right here step by step. So I put the little arrows in here for that person that's not so computer savvy, that they can actually, you know, follow this. Say, hey, click here on your clinical information tab, and then, hi, go to the guidelines for your CLP. This is where you can access some of this information, and this is where you get, you know, your clinical learning packet from, and this is where you're going to upload it to the journal. So it's step by step how to do this. So they know to create, and they know how to name it. You know, right here is exactly how you want for them to name their, you know, weekly clinical learning packets. You know, examples of how to communicate, examples, you know, step by step on how to upload their CLP, and then how to post it. So not only do they have it written, they also have the step by step, you know, guides and stuff. So there really shouldn't be any confusion with them on how to do it. And if they do, give them a referral to Open Lab, and we'll be more than happy to help them with that as well. Okay, so now that you can see that they know everything, here's actually the clinical learning packet. And so what they're going to have to do here is they're going to have to, and they should know this because like I said, they've been doing it last semester. But here, when they start to open this, it's very important for them to either to download it and save it to their device or computer. Because if they just open it up and start typing in it and then just save it, it's gone. And that's a whole lot of work for nothing. So they really need to do save as, name it, save it to the computer, save it to their device, whatever, and then they can start working in it. Right now I'm just going to open it, and of course they can open it and then save as too. Okay, so I'm going to go over the changes and a little bit of what the clinical learning packet is. So the clinical learning packet, it went under a big change last year for 101, and we did this and did some updates because it is a lot like the ADNs. It's mirrored after that. It's also mirrored after hospital documentation, like the assessment piece, because that is what they'll be seeing. So it's more accessible and more, it's electronic, so it's in the today world, right? So their clinical learning packet is here, and this is what it looks like. Under this functional status and like isolation, they can just come right in here and just highlight those. This is a simple Word document, so it's very easy to manipulate, and students can do that. Here, they can bold or highlight, and I even put here highlight or bold in the indicated section. So it should be fairly easy to follow. So if they're independent, they can go through and do that. Obviously, if they're independent, with everything else, they can probably do this. So all of these would need to be filled in, right? So we don't really want them to be leaving any kind of blank spaces anywhere. Last date of the shingle shot, if they can't find that, and then they need to just put NA or information unavailable or something like that. But at least if they're putting that tells you, hey, I did go and I looked at it and I thought about it, and it just wasn't there. Dot order, dot definition, those definitions can come straight from their textbooks. That data collection sheet, it really just comes right off of the computer for the patient's information. Other treatments, this section I put in here and is in here for those orders that are so they're finger stick blood sugars, AC and HS, or they are up to bed with every meal, or 3 times a day, or incentive spirometer every hour, stuff like that. Those other treatments. Elevate head of bed at all times, or at least 45 degrees, or elevate arm, or cold compresses to infiltration site, something like that. Discussion of medical diagnosis is the same. That comes directly from their textbooks, so they need to cite their source down here. 102 packets also have that secondary medical diagnosis. So when they're doing their primary medical diagnosis up here, and then they have those secondary ones. So their primary medical diagnosis would be over here, right? That's where they would do this. Unless I put in there that it is what the instructor said. So say Sherry's on the neuro floor, and you assign a student, a patient that's main diagnosis was a stroke last week. Now she comes in this week, and guess what? She's got another patient with a stroke, right? We're on the neuro floor. So, if you want her to do a medical diagnosis on something else, let's say atherosclerosis since she had a stroke, or hypertension since, stroke related, or diabetes, something like that, so she's not doing a repetitive medical diagnosis. That's where you step in and say, hey, you should do something different here. Then that secondary medical diagnosis, that as well, oftentimes we have a significant medical past that's this long, right? So you can pick some of those different ones. Oh, well, you may not know what rhabdo is. Why don't you do that as one of those secondary ones, One thing that did change from 101 to 102 is we eliminated the time sheet. So that little time sheet is now gone. So they don't have to do that. which I think is important in 101. 102, I think they've got it down, so that's eliminated for them here. Plan of care, there's 2 plan of cares on each page now instead of 1, and that is still the same as our normal 102 packet. Here they're going to put their concept. Since this is a concept-based curriculum that we're in, we really do encourage them to get to know these concepts. So say if their problem here is hypertension, their concept is perfusion. If their problem is shortness of breath, their concept is oxygenation, stuff like that. And there's a whole list of commonly used concepts at the bottom of their concept map, which I'll show you here in just a minute. So let's go back and say if that concept was perfusion and the problem was high blood pressure. Then they would write their little short-term goal, because it is during their clinical shift, and then their nursing interventions. Those nursing interventions and everything come straight from the textbook as well, so those that does need to be cited. And they don't have to cite it in APA format. As long as they list the book and page number, they'll be fine. So here's the concept map. So I have 4 plan of cares in there. So there's 2 sheets, so that's 4 plan of cares. The students are required to do a minimum of 3 to 4 plan of cares, okay? So those plan of cares directly correlate with the concept map. So in our example above, we put perfusion and high blood pressure. And then let's say in the second plan of care, we put the problem was shortness of breath, and the concept is oxygenation. So that would be, we've made 2 plans of care, they need to be on the concept map. If it was perfusion with high blood pressure, your supporting data, of course, would say, blood pressure was 180 over 135, and correlating medications is, metoprolol. With oxygenation and shortness of breath, supporting data would be, what's their O2 sats, and correlating medications, of course, would be, anything, oxygen on 2 liters, and inhalers and all that kind of stuff. Here in this little small box is where they will number the importance of those problems and those concepts. So, this is nursing, so breathing comes first, right? So we would put 1 here because our concept was oxygenation, and then 2 here, which is under the concept of perfusion. Here is what I was talking about earlier, that common list of nursing concepts. They're listed here for you and your students, so that way that they're easily accessible and say, hey, well, they had a problem with their high temperature. Well, that could be thermoregulation, right? They can't control their temperature, or did they have an infection? That could also be, the concept of infection right there. Okay. The medication evaluation tool, this is the same as what y'all have seen before. What they are required to put in this column is any of the medications that they are given during their clinical time there. So say if they are there from 6:30 to 12. And their medications, they have scheduled medications at 10 o'clock, and that's it. They are to list all their scheduled medications at 10 that they would be given. So that's if they gave it or they didn't give it. If they wasn't given medications on that day, they would still write down the time period that they would have given medications that day. That way it helps them prepare for next week when they're given medications. They're also to write down any PRNs that are given during that time shift. So say they have the 10 o'clock scheduled meds. They write down all of those, but then when you're in there, the patient says, hey, my pain level is a 10, right? And can I have something for pain? And you ran and you got that PRN. Or you said, hey, we'll let your nurse know, and then that way she could give the PRN. Either way, that needs to be on there for them so they can, because that kind of creates the whole picture and the whole story of what's going on with their patient, because they're going to see the effects of that drug that was given, either if they gave it or if the nurse gave it. So let's say for the example for the first one, this is going to be the entire order. So say it's metoprolol, say it's 25 milligrams metoprolol daily. And so that would be their whole order here. Then the data related to the medication prior to the administration. Well, they need to know what their blood pressure is and what their heart rate is and all that good correlating information for there. Then the data related after the medication. So did that medication work? So they need to go back and take that blood pressure again. What was their blood pressure now? If it was, 180 over 135, whatever I said earlier, then, an hour later, has that gone down? You need to put that there. You need to be rechecking. Pain medication, what was their pain level before? What was their pain level after? A lot of the medications, though, you'll see that won't, that there won't be much data that you can put here. So, let's say, for example, Protonics, and you gave, the student gave 40 milligrams of Protonics, and then how do you evaluate that, right? So, are they having any heartburn? No, stuff like that. Now, this is a new little sheet here in a new section. This is to list all the other medications that they didn't list above that are ordered. And that is to capture the whole picture as well. Let me just go right back up here. There was one thing I forgot to mention. So I explained the PRNs, and then also any pertinent medication orders. So pertinent medication orders would be those medications that are not scheduled in their time frame. So let's say the patient is septic, they have sepsis is their main diagnosis, and you're there from 6:30 to 12, but their antibiotic isn't scheduled until 10 o'clock that night, and so the student didn't list that. Well, they need to list that in order to see the big picture. Hey, you have a patient that has sepsis, so they have to have an antibiotic to fix that. What's going on? How are they fixing that? So that would be very pertinent, a pertinent drug. Same thing, say if their patient that they had was a CHF patient, but Lasix wasn't scheduled, had a lot of fluid retention, but Lasix wasn't scheduled until after their clinical shift. They would need to include that pertinent information. So this area here is going to be for all the medications that they did not do during that time that were listed up there. And we want that down because we want that student, if they listed an antibiotic or they listed that Lasix and they didn't put it up there, we want to say, hey, you know what, your patient has CHF with, signs and symptoms of, rotating fluid. Where's the Lasix? And that Lasix was a pertinent drug. So you want to be able to make sure that they see that connection. And oftentimes they don't. And so that's a really great teaching moment for you to say, hey, that was pertinent. Next time you have a CHF patient, look, are they on a diuretic at all? Or if they have sepsis, are they on any kind of antibiotic? That kind of thing. That's a great teaching moment there. The lab and diagnostic sheet is the same as it was last semester. So the test, an example, you can put potassium here and then say the normal range, 3.5 to 5.0, and then currently they're at a 2.5. Now why? Now this area right here is why, as a student, do you think that this patient is at a 2.5? What's the cause of that lab being irregular? And their example could be, my patient is on Lasix and they're, losing potassium. That's a potassium wasting drug. So they could, that could be, an example. Diagnostic test, that's where they'll have an opportunity to list that there. Of course, they don't need to list everything, just those impressions and stuff at the end. And then nursing notes. All the students, every single one of them should have a nursing note, even if there wasn't anything, in the real world when we're on the floor, right? We're not writing a nursing note every time when nothing happens. But even if nothing happens, they should still be writing nursing notes because it gives them practice opportunities to document professional language and show professionalism in their writing and how to write a nursing note. So our students, when they leave our program, are not putting patient had a red bottom, reported to doctor, right? We don't want, we want them to, be professional and use professional terminology. It's also for anything that happens that you would write a nursing note for. So say if that patient did have that high blood pressure of 180 over, 135, you could, you would put that in a nursing note. And what did you do about it? Reported, informed, MD, and new orders obtained to give, medications early, something like that, whatever had happened, and make sure that they're signing it and everything right. That does give them those little opportunities for that. Down at the bottom of that is just a little note for the students to just kind of say, hey, how do you write a nurse note? There's subjective, objective, assessment, and plan, that kind of thing, so they know that. And then attached to it, of course, is their guided prompts, so they have that correct terminology and everything there, so they can use that in their nursing notes and stuff. So that's the main part of their CLP, their clinical learning packet. And then their next one are the medication cards. Now these, I'm just going to pull it up just so they're the same, just so our new instructors can see what those look like. Like I said, there's an example of a filled out one as well, and along with guidelines and stuff. So it's kind of self-explanatory. However, this is what I will tell my students when they were, I feel like I'm looking at y'all crooked. This is what I tell my students when I had them in clinical. I said, they come to on a paper here. You can divide that up. This is a Word document. It's very, able to manipulate. And then save it for the name of the drug. Save it for the name of the drug. So for example, Protonics, say, everybody's getting I've given Protonics, so many times as, in clinical, that they're not rewriting. A big pro to having this electronically is so that it reduces their time filling out these clinical learning packets. So if they name a drug, Protonics, then they can just attach that into their journal, so they're not redoing the whole thing over and over and over. Okay, so that's your medication. And then this is their assessment tool. I already have that one pulled up. So the changes on this, it really pretty much looks the same as last semester, but the different changes are there's going to be additional terms and terminology that's added to the drop-down box. So up here, temperature, pulse, respiration. Those of you that work at our ADN program can probably recognize the format is very similar to the ADN's format. And like I said, that was so they could do an easy transition from LPN to RN program. But the temperature, pulse, respiration, they list their time, and then here's the reassessment. And then same with blood pressure. So if it was that 180 over 135, then reassessment. And they're just to click right in this box, and they can just type their time right in. Say it was 11:35 by the time they did their reassessment, and then their blood pressure now was, let's say, 150 over 100, which is still high, but looks a whole lot better than 180 over 135, right? Pain scale is still the same. The Wong Banker has the references over here for the faces, but they are to know that they're to reassess within 1 hour, and that's why that's there for them. The neuro assessment here, that one is pretty much the same as well. I don't think there's too many added terms in there. There is, I put aphasia and dysphagia. That's added, so you can see some of these terms now where they didn't know those terms in 101, they're starting to supposed to know those in 102 now. For grips, just for an example, so say this is Miss Hamani, and she's on the neuro floor, and her, they have a stroke patient with left-sided weakness. So they're saying the grips here, and other below, and here in comments, they put left-sided weakness on upper and lower extremities, and that's just an example. Like I said, it's just some different kind of little terminology added, so you can see in here how that for vision you have different little terms and stuff. Edema, we've added some additional, so now they have pitting edema +1 +4, so they should know what those things and stuff are. Another thing that has changed in here is the braided scale. So before they had to add up their scale. Now they have this block, which is a reference block. So there's no drop down box. And then the drop down box is actually what they would score from that reference. So if it's sensory perception, then if they made a 3 and it goes through and it actually calculates their score for them. So that's programmed in there for them now. And that is to, again, mock the systems at the hospital and stuff that they're seeing. Same thing here. So with their skin, all they have to do is copy and paste this. They can, and then drag it to their desired location. So they can copy and then paste, and then say they also have a stage 2 ulcer on their sacrum, right? And right here is where they would identify what that was. It's a, and how many centimeters and what's it look like and all that kind of things. Any kind of wound care orders they would put there. The next, which is obviously the last, it's still the same as it was last semester, but here's a reference for the Erickson stage. They're going to identify their stage. So say if their patient was 67, that would put them here where they would identify the stage. So they put ego, integrity versus despair. And then in the explanation, you're going to say, why? Were they in despair or are they in ego, integrity? And so they would say, well, my patient is in despair because they were just told that that their cancer had metastasized or something like that. And that is their assessment. And here is the journal. So for their journal, they're to upload, and it also has their due dates listed here. So all the due dates for the CLP is going to be at 9 o'clock in the morning. It just has different days. So if your students go to clinical on Tuesday all day or Wednesday all day or Tuesday and Wednesday half days, their clinical paperwork is going to be due on Friday at 9 o'clock a.m. to their journal. If they're at Northern with Tanya, then they have their clinical on Tuesday through Friday, so their clinical paperwork will be on Sunday at 9 o'clock in the morning. If they're with Miss Vasova on Saturdays, which is at Oak Forest, their paperwork will be due on Tuesdays at 9 o'clock. If they do not turn in their paperwork by the due date, that is a policy violation. That does not mean, hey, I got a policy violation and now I don't have to do my paperwork. No, they still have to submit their paperwork, but it is also a policy violation. So when you issue a policy violation because somebody didn't turn their paperwork in, you will just give them another due date. Of course, the due date would need to be before they, return to clinical or, before their next packet's due, whichever due date that you see fit, that you can just work that out with them, or you can send them to me, whichever you want to do. So they're going to upload all of their CLPs and stuff to their journal, and each student has a specified journal. So you'll go through and you'll find your student's name, and it's all in alphabetical order. So the example here is me, Test Rowley. And when you're pulling up a student's journal, you'll see exactly what they have submitted. Now, if it doesn't pop up right here, it's going to be over here. So you see my name, Christy Rowley, right? If that would be, your name there because you're the user. So, or this, so it's going to say Karen Spitzer, and then you're going to, look in there and there's your little journals. So my example was week 3 CLP, and that is how they need to name them so we can identify exactly which week and stuff from that. That really is the date if they have a clinical on Tuesday. And students can upload it. This is where you'll go to retrieve them because the students are uploading. And just as example, I said, hi, Ms. Rowley, attached is my CLP this week. So they can communicate to you. And thank you from the student. And I just uploaded medication cards that were blank just for the test. Then you can come in here and you can make a comment back to them. So I have already made a comment to them, and I said, if you have a student and their CLP looks good and they only have a few minor changes, you would say to them, you know, you could type in the comments, hey, a clinical packet looked great this week. The only thing that was missing is you should have included that antibiotic into your medications that were pertinent. That was a pertinent medication because your patient had sepsis. Besides that, everything else looked good. So maybe we should work on, you know, next week, you know, making sure that you're getting that connection of which meds are pertinent with your patient. There ain't no need to save it and mark it all up for that one thing. You can say that in a comment and be done with it. If they have a lot of issues on there and it's too much to say in a comment, then what you would need to do is you would need to open up their attachment, you know, save it to your computer, and then mark it up. So when you mark it up, then you can make those comments in there. You know, they have those trackers in Word and Excel where you can make those comments and stuff on there, or you can type right into the document, whichever, you know, and like in a different color, you know, if you want to make it red or something so it stands out, or if you want to make it purple, whatever. But you would put that in there. So then you would save it to your computer and then email it back to the student. When you're emailing the student, you need to use your PreciseTech account, your PreciseTech email, and you only would email it back to the student's PreciseTech email address. This is very important due to security, cybersecurity. We were actually attacked last year, and many of us, including myself, fell victim to a cyber attack through PreciseTech. So we are strictly told to only use our PreciseTech accounts. If a student emails you and it's not from their PreciseTech account, we're advised not to open it. Plus, a lot of times you don't know who booboo3248 at yahoo.com is in the first place. So if you saved it, and then I would ask you to put a comment, still put a comment. Every journal should have at least a comment in it to say, yes, things were good, or no, you know, I'm sending you feedback through your email. And so if you had to send them back, you know, stuff through their email, there's the example, and I say, hi student, I have emailed you feedback on your CLP. Please send my comments to assure that next week's CLP is correct, right? So it's just something like that, whatever you want to put. But that way it's showing, yes, I've got it. The student is aware, you know, they get an alert that somebody's made a comment on their journal, and they can take that feedback and they know to go check their email now that there's additional information in there. And that is, I think that may be all for all of that. There we go. Yeah, that was all of that. So now you kind of know your way through Blackboard and the things that you'll be using. Now I wanted to look at some of the forms that you will have available to pick up starting next week on Monday. So come anytime, you know, next week, starting on Monday, and pick up your stuff in your box. Or like I said, if you didn't have a box, it'll be in my box. And the boxes are located right beside of the elevators on the second floor where the offices are at in Bob Green Hall. So this is a student referral form. This is if you want to refer a student to Open Lab. And all y'all have those in your packets as well, like y'all always do. And you'll just place your name under the instructor, the student's name, instructor name, and then the reason for the referral to Open Lab. And, you know, let's say, for example, Miss Austin had a particular student that needed help one time on some IM injections. Sort of laughing because it's funny now, but funny then. But you know, so your reason for referral would say, you know, needs help, and you know, on IM injections, you know, on correct procedures with IM injections, whatever. And then comments following the referral, you know, we could put that be like the instructor, whoever's in Open Lab, you know, would put, you know, I've worked with her and she understands how to give an IM injection, you know, in deltoid muscle correctly, whatever. So her outcome was met, or their outcome needs a little reinforcement, and then we would sign it. We would make a copy for this for ourselves, but they need to turn that back into you, and that's showing you, hey, they did go to open lab, they were there before they came back to our clinical, and so that has been accomplished. The next sheet that you have is going to be violation of PM policy. This is again, like if they didn't turn in their clinical paperwork, or if they did something else and had a different policy violation. That's where you would use those, and they are required to come and see the lead instructor, which this semester is me, or the program chair, which is AG Ms. Lundgren. All right, and I think that's about it. For those of you that are at Novant, we have that clinical form. Let's see if I can find it real quick. Sorry about that. I just wanted to show you so I could actually say it correctly. I think this is it right here. There we go. And I'm going to be emailing all of you that are at a Novant facility, so y'all can have that for orientation for your clinical place, for your clinical facility. If you're new to a unit and new to a facility, they say 2 8-hour days is what you need. But if you're not, I mean, you kind of judge that, like Miss Spencer. Yeah, I mean, she's doing clinical on her own unit, and I think she's not going to need orientation. But go up there and see if have somebody sign this, that you know how to do that, and turn it in to make a copy of it, or and turn it in to scan it in and turn it into them. I think Nan has to have a copy of it too, so if you could shoot them an email with it and copy Nan on it, that'd be great. And I'll send that to y'all throughout in an email. Besides that, I think that is it. I hope that y'all enjoyed this orientation, that it was a little bit different, more on your time. If there's anything that I can do in the future, like I said, I feel like I'm looking all over the place. If there's anything that I can do to help you guys in the future, or anything that y'all need at all, please let me know. Like I said, I'm more than happy to help answer any kind of questions that I can. That's if I can. If I can, I'll try to find a resource where you can find that. And thank you so much, and we'll see you guys soon. Bye-bye. Hi everybody. This is going to be a quick orientation for our adjunct clinical instructors. Everybody has got crazy schedules, as you can probably see by the other schedules for clinical times and everything. We're all over the place. We're all nurses. We all work 50 million jobs and have crazy schedules along with families. So trying to organize a good time to do an orientation of Blackboard and the clinical learning packets and the forms and stuff is really impossible with our schedules. So I thought I would do an orientation this time over, online. That way you can watch it in your own time. Y'all, still get credit for coming to an orientation and really got a better orientation, instead of, trying to hunt me down and find me, because I've got a crazy schedule a lot of the times as well.